on government, we have to speak up and act, and as individuals or as organized groups, and expose complicity of government, of men, of structures like courts, their complicity in women's abuse and marginalization. And I know this is idealistic, but really, what choice do we have? We need to move on. We need to create that critical mass. And as you said, we create that public pressure and make it politically costly for change not to happen.
Thank you very much, Sherry. Excellent.
Thank you.
Thank you, Zaina, and thank you very much, Sherry.
Thank you, judges. Thank you, Grazele.
Thank you. We have now come to the last two advocate statements. I'd like to first invite Dr. Subhatra Jayaraj. She is a primary care women's health specialist with an interest in health and human rights. She is the current president of the Reproductive Rights Advocacy Alliance Malaysia. She will be presenting under the theme Health. You may start, Dr. Subhatra.
Thank you, Grazele. Good afternoon, everyone. My name is Dr. Subhatra Jayaraj, and today I will be presenting my advocate statement on the health impacts of gender discrimination in Malaysia. Women in Malaysia continue to have their individual and community health impacted by gender discrimination, violence, and coercion. The Committee on the Elimination of Discrimination Against Women affirms that access to healthcare, including reproductive health, is a basic right under the CEDAW Convention. Via the Women's Tribunal this weekend, we have heard from several women testifying on circumstances that have prevented them from achieving the right to the highest attainable standards of health. At least 6 witnesses have described how their individual and community's health have been negatively affected. Witness Agnes Padan's testimony provides a compelling example on how the right to health, specifically the right to maternal health, continues to be elusive to the Lun Bawang population of Sarawak. Maternal health includes postpartum health up to 6 weeks post-delivery. This is a period in which postpartum complications without early detection and appropriate medical intervention may lead to death. In a violation of her right to health, Agnes Padan's mother, the late Kam Agong, became a statistic that contributed to the high maternal mortality rates that are prevalent in rural and indigenous communities in Malaysia. Access to contraception has been shown as a key factor in preventing maternal mortality globally. Kam Agong conceives her 8th child. It needs to be interrogated if she was given the opportunity to access her reproductive right to decide on when, if, and how many children she wished to have, and the right to information and access to the complete range of contraception if she chose to do so. Kam Agong's experience also highlights the various social determinants of health that prevent rural and indigenous communities from achieving their right to health, such as access to logistics and transportation, access to education and livelihood. Discrimination against the Lun Bawang community can be seen as healthcare has not been equitably provided in the Lawas region of northern Sarawak. Subsequently, witness Mepung Akup's testimony highlights how her statelessness prevents her from accessing healthcare services. This discrimination on the basis of her non-citizenship is despite her being born in the current place of her residence, which is located in Malaysia. Non-citizens are required to pay a much higher rate than Malaysian patients in public health services. Witness Lata's testimony highlights that health promotion for sex workers is hindered by apparatus of the state. This is further exacerbated by the fact that sex work is criminalized in Malaysia. Sex workers form one of the most vulnerable communities to HIV and sexually transmissible diseases. Sex workers face tremendous stigma and discrimination attached to their profession, which deny them safe and quality access to preventative healthcare. Next, Witness Siti Noor brought to the forefront the discrimination faced by women with disabilities, as well as the burden of mental health that is caused by sexism and harassment in the workplace, where cases may be long drawn out and psychological sequelae persistent. Women with chronic illnesses have the added burden of negotiating multiple repeated barriers to healthcare access, affecting their mental health and financial stability. Witness Glorine Das's testimony on behalf of the late Adelina Lee Sao highlighted how women migrant workers are vulnerable to neglect, physical, emotional abuse, and forced labor at the hands of employers without adequate protection by law. Abuse and exploitation leading to poor health is compounded by the inability of women migrant workers to access healthcare services due to their work permit or documentation status, restrictions on their movements, and financial barriers. And finally, witness Tarini Kuti's experience highlights how women and gender diverse individuals in the healthcare workforce continue to be subjected to dangerous and unhealthy working conditions without proper occupational safety or hazard coverage. Her right to a safe and healthy working environment is restricted, along with her right to freedom of speech, assembly, and association. These witness testimonies have provided us with an overview of how discrimination, violence, and coercion against women negatively impacts their health. I would like to highlight a few themes which need urgent action to improve healthcare inequities that are still faced by women in Malaysia. One, despite Malaysia having successfully reduced our maternal mortality ratio, the distribution of maternal deaths remains increased in vulnerable and socially disadvantaged groups that have inequitable healthcare. Second, many women in Malaysia are unable to exercise their reproductive right to choose and face difficulty accessing high-quality reproductive health services. Third, poor social determinants of health worsen logistical challenges and prevent access to healthcare for women in Malaysia. Fourth, the requirements of formal national identity documentation are a systemic barrier to accessing healthcare for many women from diverse backgrounds. And finally, health impacts of gender discrimination have worsened due to the COVID-19 pandemic, and healthcare continues to be inaccessible for many women in Malaysia. Keeping to CEDAW recommendations, Government of Malaysia needs to take all appropriate measures to eliminate discrimination against women in the field of healthcare to ensure, on the basis of equality of men and women, access to healthcare services. We strongly recommend the following: to remove all barriers to healthcare access, especially for sexual and reproductive health and mental health services. The Government of Malaysia needs to ensure health provision, including sexual and reproductive health and mental health services, especially for rural communities. To provide access to healthcare on a non-discriminatory basis, to make care affordable for pregnant women, including non-citizens and women migrant workers, and to address the inequities in accessing health services for women with disabilities, and this includes in physical and non-physical spaces. Government needs to institutionalize non-discriminatory policies and data-driven guidelines in healthcare, to collect disaggregated data on health and tailor health programs to the specific needs of vulnerable populations from both the public and private sector, to fully exempt non-citizen women from the payment of deposits and higher fees, especially for reproductive health services, to immediately repeal the directive requiring public hospitals to refer undocumented asylum seekers and migrants to the Immigration Department, and to decriminalize sex work and associated practices, such as carrying condoms that are used to detain and harass sex workers. And finally, as a signatory of CEDAW, Government of Malaysia needs to commit to gender-responsive budgeting in healthcare, We need to invest and strengthen routine and preventive care for women and gender diverse communities, including antenatal and postnatal care, contraception, reproductive health care, and mental health services. We need to invest in long-term, durable policies to strengthen health systems, governance, and expansion of healthcare, including infrastructure and human resource in rural and remote areas. And we demand the government ensure accountability in healthcare funding, including in human resource and infrastructure projects that have been delayed, to eliminate corruption, wastage, fraud, leakages, and the abuse of power. In conclusion, discriminatory policies continue to negatively impact the health of women in Malaysia. The COVID-19 pandemic has shown that health inequities rapidly affect the health of our entire population. The government of Malaysia needs to take urgent steps to eliminate discrimination in women's health as an urgent and immediate concern for all. Thank you very much from the bottom of my heart, especially to all the witnesses who have boldly testified on behalf of all women in Malaysia. I'm able to take any questions that you might have.
Thank you, Dr. Subatra, for your presentation. Panel of judges, do you have any questions?
Thank you so much, Dr. Suba, for your clear and thorough presentation.
Sorry, I can.
Sorry. Thank you so much for your clear and detailed presentation. We will try to include your recommendations into our reports. We have no further questions.
Thank you, Nadia, and thank you, Dr. Subatra. I would like to now invite the final advocate, Kira Yusri, who is the Education Director and co-founder of Undi 18, a youth movement advocating to reduce the minimum age of voting in Malaysia from 21 to 18 years old. Kira will be presenting her statement on the theme Political and Public Life. Please welcome Kira.
Thank you, Grazele. Can you hear me okay?
Yes, very clear.
Thank you. So thank you so much for having me. I think I am the last advocate today, so hopefully I can end it on a good one. So today I want to talk about political participation and public life, especially in the area for young women and also marginalized communities. Undi 18 works in trying to platform and bring in more diverse representation in the political sphere here in Malaysia. So I will break down my presentation into 4 key areas, including highlighting some certain witnesses and certain cases and issues that I feel is pertinent to look into in Malaysia. So as an introduction, women representation in the public and political sector is not a new initiative, nor is it a radical one. It is an idea that has been debated even before Merdeka. In 1953, Khadijah Siddiq was one of the first vocal feminists who demanded more women representatives along with the right to vote. With the move towards more representation, Aisyah Ghani was successful in becoming the first ever female senator in 1962. Along with other female leaders, Shamsia Fakir cooperated in attempts to overthrow British colonialism while she was head of Awas.
Sorry, Kira. Sorry to interrupt you.
Okay.
Just like to request for you to go a bit slower for the interpreter.
Yeah.
Thank
Sorry.
you.
Thanks for the reminder. So why do I highlight all these key female leaders or key female figures in our history? For me, as a young woman, history has a lot of lessons for us to learn. We often forget the efforts of those who came before us, but these women do not deserve to be overlooked, and we should lead by their example. Today, female representation in the federal parliament and state legislature stands at only around 13% of all available seats, respectively, while in the private sector, Malaysia leads globally with 33% of senior management positions being held by women, while the global average stands at 29%. So why is it so different or seemingly so difficult in politics? I think, when we talk about women representation, oftentimes people assume that women vote the same way or women think the same way. But the fact of the matter is, women are not monolith. We are made up of people from diverse political, economic, and social backgrounds. We recognize that there is more than one way to run for office. We define political and public participation by having women represented at important institutions such as parliament and state assemblies. Participation and inclusion of women in groups that influence society, such as NGOs and political parties, should also be taken into account. We recognize that getting women into mainstream politics takes structural change, not just about the women not doing enough to run, but it's about opaque funding mechanisms, boy club nature of getting mentors and resources, the unequal cultural expectations of women to prioritize their families. We need to recognize that all these things are confounding barriers, effectively pushing women out of office. So now I want to go into certain, I think, women's experiences in Malaysia when it comes to political participation. I think a few of them have been witnesses in other thematic areas as well, so I won't take too much time to highlight their experiences. But one person, I think one significant case in 2016 saw five-term YB Teresa Kok was verbally harassed within the halls of Dewan Rakyat during the course of the debate when another member of the parliament uttered a sexist and inappropriate remark against her. The deputy speaker of the Dewan Rakyat, who was presiding at the time, went so far as to defend the statement and did not order the member to retract his statement as would otherwise be necessary under Dewan Rakyat's standing orders. In this tribunal today, we've also heard from Saraswati, Vice President of Parti Socialist Malaysia in 2011. During her detention, Saraswati was forced to take a polygraph test and was compelled to sign a 62-page document against her will, a compilation of statements taken from 20 days of interrogation. And last but not least, I think today I would also want to highlight and also speak on behalf as a Lawan organizer. During the peak of Lawan protests organized by Secretariat Solidarity Rakyat, female participants of the protests were photographed, doxed, and exposed on social media for participating in the event. One of the supporters of the protest, who was also a witness today, Shakila, a young climate activist, was sent a bloody mannequin arm to her home with threats of acid being thrown to her face and threats towards her parents. She has made a police report, but currently there are no updates to her case. So to these women's experiences, and of course thousands more when it comes to participation in politics, can highlight a few issues and actually present Malaysia's context when it comes to the safety for women to participate in politics. So women's participation in politics is hampered by existence of laws and social restrictions which limit the number of female candidates fielded during elections, making it significantly more difficult for women to become involved in the public sphere. I want to highlight three key issues or three angles of the problem, which I think is pertinent to this tribunal. Number one, quotas as a solution does not solve cultural barriers. Pakatan Harapan, the two administrations ago, had a 30% women representation promise in the manifesto, despite being a progressive coalition, had failed to fulfill them, citing a lack of qualified candidates. While it's true that quotas in the short term can have positive impact on gender representation, in 2004, the Malaysian government actually introduced a gender quota in Malaysia, requiring women to hold top positions in public sector. As a result, there was an improvement in representation, especially in women's civil service. So not the political side, but in the civil service, looking at DG, KSUs, Kota Pengarah, with the number of women in public sector jobs reaching more than 32%. However, quotas do not translate well in politics. Conservative attitudes towards women in leadership roles and systemic sexism of political institutions create obstacles preventing women's advancement within political parties and subsequently in elections and parliament and so on. The second part is the high cost of election deposits. In Malaysia, the deposit is 10,000 ringgit to contest a parliamentary seat and 5,000 ringgit to contest an state assembly seat, increased from 5,000 and 3,000 ringgit respectively in 2004. Since 2004, it was required that each candidate provide additional 5,000 ringgit deposit for cleaning up banners and posters after elections. So this does not just discriminate against women, but actually it becomes a class issue. When it comes to running for a seat in elections, it's not up to, it makes it very difficult for independent candidates to run. And what happens is that you are at the mercy of political parties with set structures and values and ideals. However, if you look internationally, measures ensuring female participation in democratic processes vary from country to country. So one of the success story is actually in Rwanda, which following the horrendous sectarian genocide that occurred in the 1990s, instituted a 30% constitutional quotas for women in elected position. 10 years after the constitutional quota was put in place, the 2013 Rwandan parliamentary elections resulted in 64% female representation in parliament. However, this success must be tempered by the reality faced by female leaders in Rwanda who are still seen as inferior to their male counterpart. So it's not enough to just implement quotas or legislate requirements. You need to also look at cultural barriers and also mindsets that are that women face when it comes to political representation. And last but not least, of course, the fundamental problem of low political representation of marginalized women, right? We look at today we've heard from Orang Asli women, disabled women, women from Sabah and Sarawak. Their perspectives and their angles are still severely underrepresented when it comes to elections and politics. So political parties must work on programs and initiatives to provide the platform for more women to get into politics. So I have two main recommendations because I think the topic of public participation is one that's very challenging to legislate, right? How do you force political parties to field more women? Do you force, how do you allow democracy to thrive while at the same time making spaces for representative and also diverse representation? So some ways to look at it is that how do you provide, how do you sort of like develop and cultivate a culture that's safe for women, especially even young women, to consider politics as a venture in their career or in their activism. So the first one being is ensuring a mechanism for parliament safe from discriminatory behaviors is integral for more women to take part in politics. We need to role model a better political landscape, a better political scene. We need to look into amending the standing orders of parliament that can, that allows for speakers to punish or to reprimand sexist or discriminatory remarks made by members of parliament towards their colleagues. This way, Malaysia can take a public stance to stand up against discriminatory remarks. So that while we want to talk about better representation of parliament, we need to not only normalize women in leadership roles, so that when these spaces are more welcoming and is a lot more, when the playing field is equal, we can have better policy making processes that considers all members of society. Second one being, I think, and is highlighted by almost every advocate today, is that legal reform that takes action against gender-based violence is much needed in Malaysia, because when women are doxxed or women are harassed and women are cyber-stalked just for being vocal, just for speaking up, for participating in protests, you would severely hamper the bravery and courage for young women to step up and speak up for themselves. So it is unacceptable that in today's time and age that such demeaning behavior against MPs, aduns, or even women activists can take place, and there are no rules or laws against it. In fact, sometimes activists are also investigated for speaking up. So it's imperative that Malaysia's parliament and subsequently, our political scene implement rules against sexual harassment as having been done in other parliaments around the world. Until then, I think the spaces will remain very unwelcoming and unsafe for women to consider politics or even political advocacy or activism as an ecosystem that they want to join in. I think that's basically my perspective and my presentation for today. If there are any questions, I welcome them.
Thank you very much, Kira, for your presentation. I now like to invite the judges, if you have any questions or comments to Kira.
Thank you, Kira, for your clear and concise presentation. None of the judges actually have any questions.
Thank you.
Thank you to our panel of judges, and thank you once again, Kira. That brings us to the end of the advocate statement. The judges will deliberate after hearing and deliver their findings and recommendations on the 4th of December. So our day 2 of the tribunal has come to an end. But before that, we would like to invite the convener of the Women's Tribunal, Ivy Josiah, to say a few words. Please welcome Ivy. Ivy?
Right, can you hear me, Grazele?
Yes, very clear.
Great. Grazele, actually, I only have one task. My only task is to thank you, Grazele Jenarun, for so ably, so graciously being, conducting yourself as the presiding officer. It was very difficult at times. 26 women came on board to give their testimonies. Of course, we had about 12 live witnesses, 9 advocates, and there was times it was very difficult as we were listening to the witnesses because they were having, they were breaking down. At the same time, there's a lot of pressure and instructions you were getting, and you're so gracious, so calm and collected. We're so happy that an East Malaysian young woman from Sabah was moderated the whole event, and we want to Basla, are you ready with your, where are you? Right, this is the only task that I have today. I'll give my closing remarks on the 4th of December after the judges have presented their findings and their recommendations. And for those who are listening to us right now, please remember that you must come back on Saturday, 4th of December at 9:30. But tomorrow night at 8:30, we are going to have an amazing arts festival. We are calling it a Feminist Arts Festival or Kebahagiaanmu Arts Festival, Kebahagiaan Dirimu Arts Festival, being curated by Rupa Subramaniam. So we'll see you tomorrow night before we see you. We'll just see you tomorrow night, and we hope to see you on Saturday because we want to hear from the judges themselves as to what they have to say about the 26 testimonies and the 9 advocate statements. Thank you.
Thank you so much, Ivy, and thank you to all the WT steering committee, all the JAG and gender consultancy. Thank you to the technical team. Thank you very much to our judges, our witnesses, our advocates, and to our sign language interpreters, our Bahasa and English interpreters. Thank you so much, everyone. See you tomorrow at the Kebahagiaan Dirimu Festival. It's the end. Thank you, everyone.